When it comes to finding a great dentist today, it's not easy. With so many choices in your community, how do you find the best dentist for your family? We caught up with a local dental expert to find their insights on what to look for when finding a great dentist, so you can keep your pearly whites shining bright.
Hi guys, I am at Glencairn Clinic in Toronto here. I'm going to interview Dr. Marlee Pereira, my community doctor. Proud to be here, and it's in Toronto. Let's check out what's going on here. So in few minutes we are going live on Facebook, and later on you can watch us on YouTube and Instagram as well. And also there were a lot of protocols to come here, so I fulfilled that before visiting the website, and let's see what she has for us. Yeah, let's check it out. This is the Glencairn Clinic. As you can see, I'm sorry I have to wear the mask, and state-of-art clinic here, beautiful office, and here is Dr. Marlee herself. Good morning, doctor.
Good morning, Wilson.
Yeah, we are here to see you, and any protocol, what I have to do, I think you have to do your stuff, and
yes,
you can check me out before we talk.
All right, perfect.
Perfect?
6.6.
Perfect. And Ryan?
All right, too. Good
Yes.
morning, Ryan. Good morning.
By the way, people who don't know Ryan, he is the person behind this show. He films the entire show and sends all these beautiful pictures to you guys. If you're not seeing Ryan so far, it's the first time you can see Ryan. Ryan, can you please remove mask for 1 minute? Yes, that's good. Now put it back. Yes, thank you. I checked out this clinic, and it's a lot of beautiful state-of-art equipments here. I don't know much about it. Let me uncover for you from Dr. Marlee. Walk us through. What is this? And this is the bench. I've seen a dentist bench. And can you just tell us what are the equipments? What do you have briefly?
This is our dental chair.
Yeah.
We have 3 dental chairs. So this is Opt 1, then we have Opt 2 and Opt 3. This is where I generally work from. This is a small television over here, and
Yeah.
since we have digital x-rays,
Yes.
the patient is directly able to see what's going on.
Instantly.
It's a good visual media for me to explain what's happening and going on.
Okay.
And we are chartless, we don't have charts anymore. So
Okay.
the entire history, everything is in here. So that's what we
Inside,
have
yes.
inside over there.
Yeah.
That's right.
So what are those hammers and chisels? What do you have there? Can you just walk us through?
They're all my toys. Wilson.
Toys,
They're all
okay.
my toys.
They're not
and
hammers.
my patients.
They're not hammers.
They're not
chisels,
hammers.
okay.
They're nothing. They're
They are
nice,
friendly. They
gentle,
don't give any pain.
Friendly toys. No, they're my little tools that help me remove decayed cavities. So yeah, you've got the air water syringe, the high speed, the low speed.
So I didn't find any, the spanners or cutting pliers,
You don't use that
pulling the teeth.
anymore.
Okay,
Technology
that's
has
okay.
changed. It's evolved.
Perfect. Any other things? Let's see your other rooms. You have 3 chairs here.
Yes.
Are they all same or they're different?
They're all similar.
They're similar.
They're
One
all
is red.
similar. Yes, we
It's
have
a red
red.
color.
We have
I like the red color though. It's
Thank
okay.
you. So
If I
we.
come, I think I have a choice to pick up this red color chair, right?
Definitely. And we have the
And
air
this-
purifiers.
Oh, yeah. Okay. That's the air
Alright,
purifier.
The air purifiers for the room.
Yeah. And
This is where we have our hygiene most of the times.
because I think because of the height, or is you just raised it?
Yeah,
Because
just raised it.
you just raised it. Okay.
Raised it.
Okay.
Again, for hygiene purpose, everything is lifted up. The lines are all drained so that there's no water clogging. So, yeah,
Guys, this is the clinic, and we will go live in few minutes, probably about 10 to 15 minutes. Meantime, I'll just have some chat with Dr. Marlee, what she done, and let her uncover some of the stuff which she's going to talk. I don't know where she studied and what she has done, and all this stuff and her expertise. I just talked to her about 15 minutes. I'll come back live. See you then. Very good morning, viewers. Welcome to our 10th episode of Local Spotlight, and happy Independence Day to all the Indians in Canada. It's a great day for all of us being Indian. I'm very happy and proud to introduce fellow Mangalorean, studied in KMC because I studied in MIT, so we have some kind of relations here. So very proud to introduce Dr. Marlee Pereira. You studied in Mangalore University, and you got a gold medal in a dental degree. I don't know, BDS or BDM they call, I'm not sure, but you can correct me later. Then you moved to Dubai. You worked there in Dubai for some time, and then later on came to Canada. You further studied in Canada from Toronto University, and you did your dual degrees here. And also, I heard that you graduated with honors, and that shows you're brilliant. I think you have all the qualities of a brilliant doctor. So walk us through your journey and tell us your story from Mangalore to Canada. Yes.
Good morning, everyone. To begin with, Wilson, it's a real honor to have you on our show. Thank you very much. Have our team on your show, rather.
Thank you.
Dentistry goes a long way. Coincidentally, when I was a kid, actually, we were in the Gulf, born and brought up in the Gulf, and chocolates were the best thing that ever happened. And my mouth actually was full of cavities. And every year we used to come down to India, and out of the 2 months I remember, most of the time went in with the dentist. And apparently we had a very good dentist who really made sure that things were right. Though I had so many cavities in my mouth, he made it always a pleasurable experience. And as time went by, I was like, oh, he made such a difference to, my life. Bringing back my teeth to what it should look, a nice smile, that's what everybody wants. And that got me into thinking for dentistry. And then as years moved on, I worked towards it. I already have that in mind. And I graduated from KMC, Mangalore, and then I had been to Dubai. I worked for a few years over there, and then migrated over here. And by God's grace, I got requalified. It was a lot of hard work and persistence, and here I am today to help you all, to help our community.
Fantastic story, Doctor. Okay. Now, after coming here, like you probably must have gone, it's a lot of hard work, probably gone through a lot of struggles to requalify, and probably you must have worked as something before starting this business. So what is your journey after landing in Canada? So how did you enroll? How many years you studied here, and how many years you worked as an associate, and when did you start this business? Yeah.
So, like everyone else, it's always a struggle with any profession in this part of the world. But like I said, persistence is the key, and determination. It's very hard to put your foot also because you have no clue. You've really got no help unless you meet the right people. I started off as a dental assistant in one of the clinics, and there I got to know a lot about the process, so that helped me a lot. Getting into the college was not easy, but I did get into, and like I said, in 2011 I passed out, worked as an associate for a couple of years, so that gave me an idea about the culture here, in Canada, how it's really practiced, because there are so many different cultures over here, you have to deal with all of them. And in 2017 I brought this practice, and I'm hoping to give the best treatment care I can in a very family-oriented way.
3 years, in 3 years you have accomplished a lot. I can see your clinic here. It's all the state-of-art equipments here, and I'm not going to ask you what it is because it is too overwhelming for me. And going back to I'm building the story line, what you struggled now, you started a business.
Yeah.
And what differentiates you from the rest of the people in the industry, similar industry? So, what are the technologies, what do you have, what are the hygiene processes you follow, and what are the best practices? In short, what are the best practices you follow in this particular clinic?
That's a really good question, Wilson. Thank you for touching on that. When I brought over this clinic, the first thing that we did was to go green, especially with radiographs. So we jumped over to digital radiography. Now that's really huge because the amount of radiation exposure is very important. It's like a split second. You have images directly then and there, they're exposed. You can diagnose if something goes wrong. You can take a second split image. You're saving on time, reducing exposure. If a patient would like to go and show that x-ray for another opinion, it's so easy, you can just transfer the file or whatever. So that's huge that we went.
Digital, yes.
Digital x-rays. And coming to how I would make a difference, like I always said, as a child, I know what it is to go to a dentist, the painstaking, the entire family going. And my aim is always to be family oriented. I encourage families to come along with their kids so that the kids are exposed when they see their parents. Parents are role models. It's very important that parents are confident when they come in, and that reflects in the kid. So if they expose that, the kind of environment, the friendliness, the staff, everything is so important. So that is my main focus. Besides that, of course, hygiene. Hygiene is so very important to keep your
very important.
Very important. A good mouth, you've got a healthier body and a happier you in the end. So that's what's important. But how do you do that? How do you maintain? And that's when we come and play. We go through schooling, we go through a lot to make sure that we give you the best that we can. So it's really essentially very important that you come in. It's very different, I must say, from what it was in India, because in India, until and unless you had pain or a swelling, you were never taken to a dentist. So it's all about emergencies over there. But here it's very different. It's all about focusing on how you can prevent. It's prevention over here. And that's why you have these regular recalls. You come every 6 months, you check what's happening. We're like little detectives, you try to detect a cavity before it becomes bigger. You don't want it to reach the pain stage. So it's all about prevention over here. Besides that, I've also realized in my experience, there are 2 categories of patients that fall under. This is a very, very broad sense.
Yeah.
Either they are very cavity prone or they are very gum disease prone. All right. Now, how do you know that? You don't know unless you come in, we take the right x-rays and do an examination and have a friendly conversation, explain to the patients, and that's how you build the support and trust. So that's another area.
So there are 2 clusters of the clients, and also here we are, preventing in India. So here in India we used to cure. That's the difference.
Yeah.
Going back to the same question, I just always wanted to ask this question. I grew up in India. Okay, we never went to dentist, and we never knew about what the heck was what is wisdom tooth. And I don't want to tell my age, knock on wood. I have not removed my wisdom tooth, and it is not giving me any problem. Why there is a big buzz here? We go to dentist. Oh, your wisdom tooth is this one. You have to extract it. You remove it, and person has to go through the long, painful process. There could be a better reasons for it. I may be very ignorant on this one. Educate me and educate our viewers. What's it all about, and what's the right process to do it? Is it good to do it or not good to do it? Walk us through.
Yeah. Great question again, Wilson. Thank you for asking, because a lot of our questions, like I said, they're very family oriented. They come with their kids, and this is a most often asked question. Just that you're very young and you're asking me this question right now, but doesn't matter.
Thank you. You made my day.
All right. Wisdom teeth. Wisdom teeth are one of the last molars to erupt, all right? And usually when they erupt, some people have no issues with it because there's enough of space for it to accommodate.
Yeah.
But most often, the majority of the population now, it's probably because of environmental changes, our dietary changes, things have changed. The jaw no longer grows big enough to accommodate all 32 teeth. And so by the time these last wisdom teeth erupt, there's usually insufficient space, or they're trying to erupt at an angle, or it's the wrong position. And this in turn causes food lodging, all right? Food lodging eventually leads to decay. So now you've got a decayed wisdom tooth and a decayed good tooth, the molar in front, which you use it for chewing and grinding. So like I said, the best way is to come into the dental office, review your case. Each person is different, but like I said, most often it's always better. Let's say, for example, the wisdom tooth has no space to grow, it is hidden, it is under the gum, and eventually you see it that it may cause problems 10 years from now, 15 years from now. It's always best to extract. Extraction is easier when you're younger, healing is so much more better,
okay.
All right, as compared when you grow older. Sometimes when you grow older, you land up with some cysts, some other disorders, which is Not always, but it can happen. So in order to avoid that, again, it differs from person to person, situation to situation. In yours, you might have enough of space. It's erupted well, so be it. We don't touch it.
Thank you. Yeah.
But cases are different, like I said, now because of environmental changes and so many things happening, things are different now. The statistics is just different from what it used to be.
See, this you're a typical product of KMC, because I know what is KMC all about, because we studied in the same campus, and KMC has produced one of the best doctors in the world, around the world. I mean, especially they're more of in North America right now, and you shows your caliber, and I'm very proud of proud that I'm from the same campus. Thank you. And going back to a practical question again. There are many people not covered in insurance, right? So there's employment insurance, that's fine because you're not paying from your pocket. And a lot of self-employed people, like who are not salaried and they are not covered. Because it's not an inexpensive procedure.
Yes.
So do you help people? I don't want to go to nitty-gritty stuff and the price and other stuff. But do you help those kind of people who do not have insurance coverage and were struggling to pay that kind of huge bills? Can you just give us, without going to very detail, and just can you give what's your take on that and how you help those kind of patients?
Like I said, Wilson, from the very beginning, we are very family oriented, all right? The person is more important, all right? And things happen, situations change. We have many patients like this who come, all right? And what's important is maintaining your oral hygiene. That's most important. And yes, we do help. It's very important to help because again, situations can change. You can get an insurance back,
That's right, yeah.
not the issue. The issue is maintenance, like I said, prevention. Just make sure that it doesn't get any worse. You don't want to be investing more. You'd rather spend some amount. We help patients, all right? We don't charge them the insurance charges. We do help them, but maintain, come regularly. That's most important than, not doing anything at all. You're doing more harm
than not coming here.
Not coming in.
Well said, doctor. Once again, guys, I'm with Dr. Maria here. You can see her clinic. You can see her equipment here. She belongs to my community, and she's probably young upcoming doctor too. So please like, share, comment about this particular episode so that you spread this news and spread this business and help all these local businesses, and you have a chance to win $25 Amazon gift card. And in fact, 4 people will have a chance to win Amazon gift card courtesy Dr. Maria Pereira. So let's go on with my few more questions. Whenever I think about dentist, the first thing comes to my mind, I don't know, it's a phobia, chisel and a hammer. I'm so fearful. And it's even now, even though we go, and that's the phobia I think most of the people they have. And what kind of advice you have, for the people who are so fearful to visit the dentist, and how safe it is, in terms of pain wise, how safely you do your procedures without giving much pain. I mean, there is a little bit. Jesus Christ died on a cross, and this is not as painful as that. How do you manage that fear of a patient?
Well, Wilson, that's what majority of the population face, fear towards a dentist. I guess the moment they hear the word dentist, they freeze. That would even work better than our freezing that we give, I must say, they freeze to that extent. But yes, again, it's all about, I think, communication, open communication, talking about what's the fear factor. Most often they are past bad experiences when they were small, and that's just embedded in them. And that has prevented them from coming and, even trying out and seeing what dentistry has to offer now. Dentistry has evolved so much. It's rather become so much more painless than what it was. The technologies, the products, the innovations have all helped dentistry make it even more pleasurable now. I mean, patients love coming. They say, I love coming to my dentist. And like I said, one of the things is the atmosphere, the environment. I think that is the hugest thing, and that's what we focus on over here. That's one. And when it comes to injections, that's another thing. I often tell my patients before I inject them, you know what? Have you guys ever experienced a mosquito bite?
Always.
Right? And they say,
Every
yes,
day,
I have. And I'm like, okay, I'm going to give you a mosquito bite, but this mosquito bite is going to be with a lots of love. And then they're like wondering, okay, is this true or not? And I go ahead and give. I don't lie. I don't tell them it doesn't hurt. I just say, it's just a slight pinch of mosquito bite. I do that with kids too, and it works. So the idea is letting them know in advance, what to anticipate.
Relating to the pain.
And relating to the pain.
Yes,
of course, one or two will just turn around and say, Doc, that was not a mosquito. I ask him, then what was it? That was a scorpion, they go. So,
bit of exaggeration there, yeah.
Each one's threshold, but yeah, like I said, the trust and communication is what will help.
Okay, this is actually for the upcoming youth, and there are a lot of young, budding talent in our community, and there are hundreds of professions they can choose. Unlike back home, we had only 3 choices: science, arts, and commerce. Okay, that's all things we could think of. Then after the degree, you diversify, and after the pre-university, you go here and there. But here they have a lot of choices. And what advice you have to our community youth who wants to become a dentist, and how, what's the process, and what are the pros and cons of this particular industry? Can you just give this advice to our youth? Yeah, no, not patients, to the youth who wants to pick up this profession.
Okay. Yeah. Dentistry is a great profession, but it's a lot of hard work, and it's a long journey too, What I would suggest for students who are looking to probably get into the industry, try to find yourself a place where you can shadow a dentist and see what life of a dentist in a dental office is, maybe for a couple of days or for a week. So the interactivity, what goes on, what's the atmosphere and stuff like that. Once you think you're okay, you're able to handle it, work towards it, because it's a long, long way. You've got a series of exams to do. And most importantly, have a mentor, right? A mentor who will constantly guide you and, pep you up always whenever you feel low, and things like that. And I'm always there. Anybody wanting any help, any shadowing, any suggestions, I'm always there.
I was about to ask that question. You answered before I could ask, because that's what I wanted to ask. Are you prepared to mentor our youth, and whether they can come here to do the job shadow and see how the profession looks like? You already answered that. Hats off to you.
More than happy.
Thank you very much for offering this help. That's meant a lot. Going back to my last question, and it's very important, and it's very dear to me. It's very close to my heart. I mean, I genuinely salute you. Not only you and your fellow colleagues and who are in the frontline work, and you guys are prone. You're playing with the danger. Like this particular tough time, and you are at a very, very close proximity of that particular patient. And if there is something happens, you're the first one to get it. And a person could be asymptomatic. I could be asymptomatic. I'm here talking to you. Although you tested me before coming here, that's a different story. But how do you take all these preventive measures while dealing with the patient during this COVID-19? And how do you protect yourself? I know I asked this question before entering, but you had a very lengthy answer to that. But can you condense it and tell our viewers? Yeah.
COVID has definitely been a difficult time. Fear of the unknown, because it's such a novel virus that things have changed by the day, I must say, not even by the week. Every day, something new. Okay, let's do this, let's do that. And we've had series of protocols from the Royal College of Dental Surgeons as well as the Public Health, and they had some guidelines in place after 2.5 months when we were given permission to open in mid-June. One of the first few things we do is pre-screening, like what we did with you. Pre-screening a week, a day prior, the day they come into the office, their temperatures are taken. That's the first thing. Because as far as possible, we try to take COVID negative patients. Now, what does it mean, COVID negative? As long as you're free from these symptoms, we take you. There's always things to do, you have to address, you just can't turn away people, this is our profession, you need to deal with it. So these are the first few things we do. Temperature is taken when you come into the office. And we have other very strict infection control protocols. For example, our sterilization techniques. Everything is bagged, everything is pouched. The rooms are sanitized. You have sanitizers all over the place. Patients have to go wash their hands and then they come in and they sit. Everything is a masked environment. I know I'm talking without a mask, but we are all a masked environment, all of us. We try to maintain the 2 meters distance. And when we are working, we have our eye protection, we have a face shield, we have a double mask, we wear gowns. You will not recognize us. That's what we tell our patients. Sometimes we just put our name tags, you know who we are, because sometimes it's just impossible to recognize. It's a big challenge, mind you, for us to work behind those. But we do what it takes because the safety of our patients, the safety of our staff is more important to all of us.
Basically, you guys look like astronauts.
We do.
So I want to make sure it's you, if at all, if I come back, so before you put all these gadgets on your face, because I don't want somebody to perform on my teeth. So going forward, and the last question, before we say bye to our viewers, any last message you want to say?
Yeah, Dazzling Smiles has always been my motto, and it's a wonderful feeling to restore someone's smile. So please know that Glencairn team is always here. We are a family-oriented office, always willing to accept anyone who comes. We'll never say no. Feel free to come by, all right, and speak, even a call, if you need a second opinion or anything, and we're always here to help me. A healthy mouth, a healthier body, a happier you. Just remember that.
Thank you, Doctor. Wisely said, and beautiful last final words from you. And we will be putting, Dr. Maria's clinic's information on our page, their website, the information. There are a lot of technology. I think even for COVID-19, patients can do before coming here, perform so many things, the test by themselves. Put all the information on the website. She did not say that, but I was asking these questions when I walked in to this particular clinic. Before coming here, I also visited. Performed all those tasks before arriving here. They have a technology, use it. And before we wind up, thank you very much for the viewers, all the viewers. And without you, we won't be able to do this show continuously. And thank you for your support, and counting on your support in the future too. Please like, share, and comment on our page. What do you like? What you didn't like? And tell us about it. So, and also help the businesses as well by talking about this particular dental office. It's a beautiful facilities here, state-of-art clinic. Come and visit and check this out. And if you like, share, and comment on our page, this particular show, you have a chance to win $25 Amazon gift card. 4 people have a chance to win. Please like, share, and comment. And finally, I thank my filming person Ryan here. Ryan is back. He's doing an amazing job in the background. And also I thank my team, Vinisha and Phil, for doing all this post and pre-promo of all local spotlight. We'll see you next Saturday, same time, same place. Till then, wishing you all very happy, lovely weekend. Thank you.
Hard to believe it, but with the right dental professional, you can have the teeth you've always wanted in a very short time. Take advantage of our guest speakers' expertise by calling the number on your screen. Thank you for joining us.